So having sex once a week compared to like once a year is mathematically associated with a 49% decrease in all-cause mortality.
Which is just a staggering number to start off with.
Right. I mean, usually when we talk about increasing our life expectancy, the conversation feels, well, incredibly clinical.
Oh, absolutely. It's all metrics.
Yeah, we treat longevity like this sterile math problem, counting your steps or tracking your cholesterol or choking down those green kale smoothies every morning.
Yeah, exactly.
But we rarely talk about intimacy as a matter of literal survival. And for you, the listener, that is exactly what we're getting into today.
It completely disrupts the way we view aging. And, to set our foundation right at the beginning of this deep dive, what we have to understand is that sexual dysfunction is almost never an isolated problem.
Right. It's not just a local issue.
Exactly. It is rarely just a glitch in the hardware, so to speak.
Yeah.
It is the ultimate barometer for your holistic health. It's deeply, deeply interconnected with your cardiovascular, environmental, and, well, emotional well-being.
Okay, let's unpack this. Because a 49% decrease in mortality is a massive claim. Today, we are digging into the signs of exceptional sexual health, and we're using this truly fascinating interview with urologist Dr. Reena Malik on the Diary of a CEO.
Such a great source.
It really is. And our mission today is to strip away all those cultural myths, the awkwardness, and the genuinely terrible internet advice out there to uncover the actual data-driven roadmap to better intimacy, stronger hormones, and a longer life.
Which everyone wants, right?
Right, exactly. And the data from these sources goes even further than that first statistic I mentioned. There's this one study from 1997 tracking longevity that found some just staggering correlations.
Right, yeah. That study followed men over a decade and found that for every 100 orgasms they had, their life expectancy actually increased by 13%.
Okay, but I have to push back hard here on the whole causation versus correlation thing.
Fair enough. It's a good point.
Seriously, I mean, a guy who is out running marathons and eating well is just naturally going to have more physical energy for sex than a guy who is, say, bedridden or dealing with a chronic illness. So how do we know the physical act of sex is actively repairing their bodies rather than it just being a byproduct of them already being healthy?
Well, that is the crucial question researchers have to isolate, right? And causation is notoriously tricky in medical studies.
Yeah.
But when we look at the actual physiological mechanism of what happens during sex, the physical maintenance is undeniable. Intimacy acts as a legitimate cardiovascular workout.
So it's like going to the gym.
Pretty much. You are actively increasing your heart rate, engaging in moderate physical activity, and inducing this massive hormonal flush that helps regulate stress.
Wow. Okay.
And beyond the sort of treadmill aspect of it, it actively combats loneliness. And we know from the World Health Organization that chronic loneliness carries the equivalent health risk of smoking 15 cigarettes a day.
Wait, 15 cigarettes just from being lonely?
Yes. So the hormonal bonding from intimacy actually mitigates that specific systemic stress.
So the body is actively being exercised and hormonally reset. The source material also talks about this biological principle of use it or lose it when it comes to tissue health.
Exactly, because the body has to actively work to maintain the health of these specific tissues. Take nighttime erections, for example.
Right.
Younger men naturally experience them 3 to 5 times a night, and they can last up to 40 minutes each.
That's a huge portion of the sleep cycle.
It really is. And what is happening mechanically is your body is forcing highly oxygenated blood into a spongy genital tissue called the corpora.
Okay.
It's delivering fresh oxygen to prevent tissue fibrosis.
Fibrosis meaning scarring.
Yes, exactly. Fibrosis is essentially internal scarring that leads to physical shrinkage and a loss of elasticity. So the act of filling those vessels, whether that's through sleep cycles or physical intimacy, is literally keeping the organ alive and functional.
Man, so if the physical mechanics require that much continuous, robust blood flow to prevent scarring, how does diet physically change those vessels?
Oh, it changes everything.
Because we always hear these broad claims about eating well, but the sources give some very specific nutritional targets for, well, the underlying plumbing.
The connection between the kitchen and the bedroom is profound. Adopting a Mediterranean diet, for instance, lowers the risk of erectile dysfunction by 22%.
22% is a big jump.
It is. But let's look at the specific mechanisms. Eating 100 grams of pistachios every day actively decreases ED.
Okay, pistachios.
Yeah, and eating blueberries, which are packed with specific compounds called flavonoids, yields a 20% improvement in erectile function.
Okay, let's pause on that. Why pistachios and blueberries?
Yeah,
What is the actual biological lever being pulled when someone eats a handful of berries?
it comes down to nitric oxide.
Nitric oxide, okay.
Right. Flavonoids actively stimulate the lining of your blood vessels to produce more nitric oxide, which acts as a powerful vasodilator.
Meaning it opens things up.
Exactly. It tells the blood vessels to relax and open up, allowing a huge rush of blood flow. And interestingly, this is the exact same biological pathway that pharmaceutical drugs like Viagra target.
Wait, really? So blueberries are essentially doing the same job?
Yes, you are just fueling it naturally.
Mm.
And the same goes for dietary fiber. When you eat fiber, your gut microbiome ferments it and converts it into short-chain fatty acids.
Okay, I've heard of those.
Yeah, these fatty acids circulate in your bloodstream and literally protect the inner lining of your blood vessels from inflammation.
So you are basically armor plating your vascular system.
Exactly.
And that translates directly to exercise too, because the data shows that just 150 minutes of moderate cardiovascular exercise a week yields the exact same improvement in erectile function scores as taking a prescription pill.
Which brings us to a really vital medical concept. Erectile dysfunction is often referred to as the canary in the coal mine by cardiologists.
The canary in the coal mine, meaning an early warning sign.
Right. The blood vessels in the penis and the clitoris are microscopic compared to the major arteries in your chest.
Okay.
Because they are so tiny, they are the very first to clog or stiffen when your metabolic health starts failing.
Oh, wow. So they show the damage first.
Exactly. If someone develops organic erectile dysfunction, it frequently precedes a major cardiac event, like a heart attack, by 3 to 5 years.
That is terrifying.
It is your body's early warning system flashing red.
That shifts the perspective entirely. It isn't just about sexual performance. It's an urgent medical diagnostic. But, the plumbing is only one half of the physical equation. We also have to talk about the muscular framework surrounding it, the pelvic floor.
Yes, so important.
This is a bowl of muscles at the base of your pelvis that physically controls the area. During an orgasm, these muscles contract rhythmically every 0.8 seconds.
Which is incredibly precise.
Right. But I want to introduce an analogy here because the internet is just obsessed with telling everyone to do Kegel exercises to strengthen this area.
Oh, the internet loves Kegels.
Yeah, but if your pelvic floor is tight from chronic daily stress, doing Kegel exercises to tighten it even more is like doing bicep curls while you are actively suffering from a severe muscle cramp. It is completely counterproductive and painful.
That is a perfect analogy. People carry emotional stress in their pelvic floor exactly the same way they subconsciously clench their jaw during the day.
Oh, like getting TMJ from grinding your teeth.
Exactly like TMJ. When those pelvic muscles are constantly clenched and stressed, they act like a clamp on a garden hose. They physically cut off the blood flow and nerve signals to the genitals.
Wow.
For men, this hypertension can manifest as premature ejaculation, or ED. And for women, it can cause extremely painful sex or the complete inability to become physically aroused.
So tightening is the exact wrong move.
Right. Instead of clenching and strengthening, what is desperately needed are relaxation protocols. We are talking about things like child's pose from yoga, deep diaphragmatic breathing, and literally retraining the nervous system to let those muscles drop and release.
So you could have perfect vascular health from hitting the gym and eating pistachios. But there's this master switch that can turn off your libido overnight regardless of your diet, which is your environment and your stress hormones.
Absolutely.
Let's look at sleep. The source material noted that sleeping just 5 hours a night instead of 8 hours drops a person's testosterone by 15% in just 1 week.
To put that in perspective, a 15% drop is the hormonal equivalent of aging 10 years in 7 days.
That is insane. 10 years of aging in a week.
Yeah. And sleep apnea is a massive, often completely invisible culprit hijacking this process.
Right. People don't even know they have it.
Exactly. The source provides a very practical metric here. If you're a man with a neck circumference over 17 inches, or a woman with a neck over 16 inches, you are at a significantly heightened risk for sleep apnea.
Because of the physical weight of the neck.
Yes, the physical weight of that extra tissue is compressing your airway at night, suffocating you microscopically, and ruining your sleep architecture. Simply getting a CPAP machine and fixing that apnea can cause testosterone levels to spike by an incredible 200 nanograms per deciliter.
That's a massive natural boost.
Huge.
And it's not just the air you breathe while you sleep, it's the physical objects you interact with. The sources highlight endocrine-disrupting chemicals, specifically phthalates and BPA, found in warmed plastics.
Right, the dreaded microplastic.
Yeah, these chemicals actively mimic estrogen in the body and aggressively reduce testosterone. But we also have to factor in the people around us through social contagion.
This part is fascinating.
A massive study of 50,000 people showed that if you surround yourself with sex-positive influences, safe sex practices increase by 46%. On the flip side, if your friend group constantly complains about their sexless marriages, your brain subconsciously normalizes a total lack of intimacy for your own life.
The environment completely shapes our behavioral baseline.
But wait, I have to ask about the practical reality of this. Between dodging microplastics in every container, treating sleep deprivation, and managing a stressful job, if someone is obsessively stressing out about avoiding a plastic water bottle at lunch, doesn't the cortisol spike from that anxiety do more hormonal damage than the plastic itself?
If we connect this to the bigger picture, you are absolutely right. Chronic stress is the ultimate enemy of the human libido. High cortisol actively dampens testosterone production and locks your entire nervous system into a fight-or-flight state.
And you can't be intimate when you're running from a tiger.
Exactly. Biologically, you cannot become physically aroused unless your nervous system has shifted into the parasympathetic rest and digest state. So the medical advice is to control what is frictionless.
Right, the easy stuff.
Yeah. Don't microwave your food in plastic containers. Switch to a metal water bottle, but do not let it become an obsession. Instead, channel that energy heavily into stress reduction. Well, the Gottmans, who are renowned researchers on relationship longevity, suggest interventions as simple as a 20-second continuous hug or a 6-second kiss.
Wait, specifically 20 seconds and 6 seconds?
Yes. Those specific durations physically break the stress loop in your brain and signal to your nervous system that you are safe enough to drop your guard.
That is so actionable. But okay, once you have your physical health and your environment optimized, you still need the actual user manual for the human body.
Which so many people unfortunately lack.
Right. A profound lack of anatomical knowledge leads to massive performance anxiety and frustration in the bedroom. So let's slow down and demystify female anatomy. The clitoris is actually the homologue of the penis. They develop from the exact same embryonic tissue in the womb.
Yes, and the crucial misunderstanding here is that the part visible on the outside is merely the tip of the iceberg.
Just a tiny fraction.
Exactly. The actual anatomical structure of the clitoris extends deep down into the pelvis, wrapping around the vaginal canal. And because of how this internal geometry is laid out, only about 85% of women can achieve orgasm through penetration alone. Wait, let me correct that. Only about 15%, meaning 85% physically require targeted external clitoral stimulation.
Which completely reframes how we look at intimacy. I mean, expecting a woman to orgasm from penetration alone is essentially like stimulating only the testicles or the perineum of a man and expecting him to climax. The anatomy simply isn't aligned for that to work effectively.
That is a stark comparison. But anatomically, it is highly accurate.
Yeah.
The structures are identical in biological origin, just arranged and distributed differently.
Right.
And this shared embryonic blueprint also explains another highly debated topic in the sources, squirting.
Which occurs in about 40% of women.
Yes. The fluid originates from the bladder, but it is combined with secretions from the Skene's glands.
Wait, hold on. Skene's glands. The sources said the female body essentially has an equivalent to the male prostate.
Precisely. The Skene's glands are the female homologue of the prostate gland.
That's...
They even emit prostate-specific antigen, or PSA, and high levels of zinc, just like male prostate fluid does.
Wow, okay, but why?
Well, from an evolutionary perspective, theories suggest this mechanism might have evolved to forcefully flush UTI-causing bacteria out of the urethra in a pre-antibiotic world.
Oh, that makes a lot of sense.
Yeah, and other theories suggest it acted as a neurological reward system to incentivize specific mate selection.
Fascinating. And, you know, navigating all of this anatomy isn't just about internal structures. The surface of our skin has its own specific user manual.
It does.
Human touch relies on highly specialized nerve fibers called C-tactile efferents. These nerves don't care about pressure or temperature. They respond specifically to a slow caress moving at about 3 centimeters per second.
It's so specific.
Very specific. But here's where it gets really interesting. They only fire when stimulated by human skin. If you try to stroke someone at that exact speed using a latex glove or, say, a robotic arm, the nerves stay dormant. The human nervous system is literally hardwired to seek biological connection with another person.
Which is beautiful, really. And this physical hardwiring highlights why active communication with your partner is so vital. You cannot guess what the nervous system wants,
Right.
but the timing of that communication dictates its success. The experts strongly advise against discussing your sexual issues or desires while in the bedroom or immediately after intimacy.
Because it's too vulnerable.
Exactly. The emotional pressure is far too high. Instead, you want to initiate these conversations when you are walking side by side or driving in the car.
Removing that direct confrontational eye contact.
Right. It immediately lowers the defensive pressure. And once you establish that safe baseline of communication, you can begin to introduce novelty. Adding a slight challenge or something new to your routine induces what researchers call a sexual flow state.
Like being in the zone at work.
Operating on the exact same psychological mechanics, yes.
Oh.
Like entering a deep flow state of intense focus while working on a complex project.
I love the idea of a flow state for intimacy. But to truly access that, we have to aggressively unlearn the toxic metrics that society pushes on us. Oh, the metrics are so damaging.
There is immense profitable pressure to hit certain numbers or sizes, leading to extreme solutions that often cause profound, permanent harm. Let's look at the craze around TRT, or testosterone replacement therapy.
A huge industry right now.
Massive. It's true that average male testosterone levels have dropped 25% since the 1990s, but a heavily ignored driver of this is the rise in obesity.
Let's explore why that is. Fat tissue is not just inert baggage sitting on the body. It is a highly active endocrine organ.
Meaning it produces hormones.
Exactly. It contains an enzyme called aromatase. And aromatase literally hijacks the testosterone circulating in your blood and chemically converts it into estrogen.
Wow.
This is the exact mechanism that causes gynecomastia, or the development of male breast tissue.
So the body is actively cannibalizing its own testosterone. Now, TRT clinics are popping up everywhere to fix this. But what patients aren't being told is the brutal consequence of exogenous hormones.
The side effects are severe. 70% of men who go on TRT become completely infertile within 18 months.
Right, because the brain senses the external testosterone and permanently shuts down the body's natural factory.
Exactly. And anabolic steroids take this to a lethal extreme, carrying a 15 times higher risk of premature heart failure.
15 times.
So here is my pushback. If testosterone naturally drops only about 1% a year with normal aging, and hopping on TRT shrinks your testicles and causes infertility, why are so many perfectly healthy men in their 30s desperate to jump on a needle instead of just going to the gym and lifting heavy weights?
It comes entirely down to the immense visual pressure generated by social media and pornography. People are not chasing health, they are chasing a shortcut to an extreme aesthetic.
Right.
But biologically, the human body has limits. More testosterone is not better once your body's androgen receptors are fully saturated.
So like a sponge that can't hold any more water.
Exactly. If those chemical receptors are full, pouring more synthetic testosterone into your system does not improve your mood, your energy, or your libido. It just severely thickens your blood, skyrocketing your blood pressure, and permanently damages your heart tissue.
And we see that exact same visual pressure completely distorting reality when it comes to penis size.
Yes, another area full of misinformation.
The clinical data shows the average erect penis is between 5.2 to 5.5 inches. Women anonymously report wanting an average of 6 inches. Yet when researchers analyze the actual purchase data for the most popular sex toys, consumers are overwhelmingly buying products that are exactly around 5.2 inches.
The reality just doesn't match the panic.
It doesn't. But men still panic, turning to incredibly dangerous DIY enlargement trends like jelqing,
Oh boy.
which involves aggressively manually stretching the tissue.
Which is medically disastrous. That manual stretching just creates severe micro tears in the delicate vascular tissue, which then heals as scar tissue.
And like we discussed earlier, scarring is bad.
Right. As I said, fibrosis and scar tissue are the literal definition of organic erectile dysfunction.
Yeah.
You are destroying the exact function you are trying to enhance.
It is tragic.
If a patient actually requires lengthening for medical reasons, clinical traction devices are the only safe route, yielding perhaps 2 centimeters of length over a grueling 3 to 6 month period.
And this desperation intersects with the newest medical craze, massive weight loss drugs like Ozempic. Because these GLP-1 drugs reduce the fat pad sitting above the base of the penis, it can artificially make the anatomy appear longer, but there is a massive biological catch hidden in how these drugs operate.
Yes, GLP-1 agonists work directly on the brain.
Yeah.
They dampen the brain's core reward pathways.
Yeah.
That is precisely why a patient loses the obsessive desire to eat and frequently loses the urge to gamble or drink alcohol.
So it turns off the noise.
Right. But the emerging concern among urologists and neurologists is that chemically dampening that master reward center might also significantly lower or completely turn off a person's intrinsic sexual desire.
Oh, wow.
You might look better in the mirror, but completely lose the biological drive to connect with anyone.
So what does this all mean? If we zoom out and look at everything from the protective mechanics of the Mediterranean diet to the suffocating effects of sleep apnea to the exact 3 centimeter per second speed of a human caress, incredible sexual health isn't about buying magical pills, risking disfiguring surgeries, or trying to perfectly emulate the extreme, curated bodies you see in videos.
Absolutely not.
It is about viewing your sex life as the ultimate, unfiltered reflection of your holistic health. Your vascular system, your sleep architecture, how you manage your daily cortisol levels, and your willingness to just openly communicate with your partner without confrontation. Those are the true biological foundations.
It is an incredibly intricate ecosystem. You cannot continually neglect the foundation of the house, poison the soil, and then expect the roof to hold up simply by painting it a different color with a quick fix.
I want to leave you with a final thought to ponder. The source material highlighted how our modern lifestyles, specifically the fact that many of us are actively scrolling on our phones for 8 to 10 hours a day, completely hijack our dopamine systems. We are chronically distracted, always waiting for the next 15-second video to give us a hit of novelty. If our brains are constantly flooded with this high-speed, endless digital noise, perhaps the future of maintaining a healthy libido won't rely on finding more extreme physical stimulation in the bedroom. Perhaps the real secret to exceptional sexual health in our modern world is having the discipline to actively engineer boredom and profound digital silence into our daily lives, just so our natural desires finally have the quiet, unrushed space to surface again. It brings us right back to where we started. Maybe longevity and exceptional health aren't just a clinical math problem of constantly adding supplements and hacks to your life. Maybe it's entirely about knowing what to subtract.